is Dr. Jainesh, Advanced Gynaecological Endoscopic Surgeon for Motherhood Hospital, Kharghar. Today we are going to discuss about signs, symptoms and investigations of fibroids. So what are fibroids? Fibroids are benign growths. More than 95% of the times they are non-cancerous. They are basically fibromuscular growths which appear inside the uterus. We don't know the exact cause why they happen. However, 50% of the women who end up in a gynae OPD complain of the same. So what are the common signs and symptoms which a person who can have a fibroid present with? So usually 50% of the times a fibroid is asymptomatic, that the woman does not know that she has a fibroid inside her uterus. She does not have any complaints and they keep on slowly growing in size. The rest 50% of the patients can present with varied complaints. So the most common of them is heavy menstrual bleeding. That is, the menses may be heavier in volume, that is more number of pads per day, or they can have prolonged bleeding for 7 days, 8 days, 9 days and so on. They can have intermenstrual spotting, especially if you have a fibroid polyp, that is in between your menstrual calendar, you will have spotting which will not be explained by any other thing. Apart from this, the other common subset of patients with complaints of fibroid is the patients who are trying to conceive, that is patients of infertility. So fibroids form a common cause of infertility if they are in the form of a fibroid polyp, or they are pressing on the endometrium, which causes a problem with the pregnancy growing, is associated with miscarriages. A fibroid more than 4 cm in size causes local disturbance, which does not let a pregnancy conceive and grow in size. The rarer complaints are if there is an anterior fibroid which is large, may cause pressure on the urinary bladder and can cause problem with repeated urine tract infection, and furthermore if ignored can cause damage to the kidneys. Posterior foul fibroid can cause damage to the rectum, the sigmoid, that is basically the bowels, can present with both diarrhea as well as constipation. Any laterally growing fibroids can pressurize on the ureter, which is the communication between the kidney and the bladder, and can cause back pressure changes in the kidney and can cause more damage. So these are the common signs and symptoms with which a patient of fibroids present with. Now everybody who comes to a gynae OPD invariably undergoes a sonography. So the 50% of the asymptomatic fibroids which we don't catch because they are not having any complaints are caught on the sonography. So now let us come to the investigations which are supposed to be performed. So usually, as I said before, that sonography is a good way to detect a fibroid. That is, you can either undergo a transabdominal sonography, that is a sonography through the abdomen, or there is a transvaginal sonography which is run through the vagina. Now transvaginal sonography has better resolution, so if you are comfortable with the procedure, you should always go with a transvaginal scan. 3D and 4D scans also help us to exactly locate the size and the site of the fibroid, which we call as fibroid mapping, which is very well helpful for the clinician to understand what to do about it. The other lesser performed investigation is an MRI, which is done in very specific conditions in which the fibroid is growing very fast in size, or there are multiple and the sonography is not able to capture all the defects, or there is something which is raising a query that it can be cancerous. So in those conditions, an MRI is done. Now in my next video, I am going to talk about how to go about the management of the fibroids, that is, which cases needs to get operated, which cases can be managed medically, which patients are supposed to get it done even though if they don't have symptoms. So hereby signing off, Dr. Jainesh Doctor.